Esther, welcome.
Thank you. I request to be excused to take off my mask so I can be audible enough. Good afternoon, ladies and gentlemen. Protocol observed. I am Esther Suvi Deborah. I am a triumph self-advocate, and these are my colleagues. And I'm so grateful you're standing behind me because it gives me courage to stand and talk before you. I'm a finalist at Uganda Christian University in Mukono, which is indeed a center of excellence in the heart of Africa. I'm pursuing a Bachelor of Arts in Mass Communication, and I'm majoring in journalism. Yes, the people who go to the field to bring the news to you. Currently, today I'm bringing information to you standing here. I am a peer educator at Triumph Uganda, and I'm a person with psychosocial disability. I would like to take us through the policy paper. This is a policy paper on access to sexual reproductive health rights for the adolescent girls and young women with psychosocial disabilities. According to the World Health Organization report of 2011, women and girls with disabilities account for almost 1/5 of the world's population of women. In Uganda, the total population of people with disabilities, according to the Population and Household Census of 2014, is 13.6%, which is equivalent to 7,500,000. And unfortunately, it's not gender segregated. Importantly, data from the Jinja District Records Office shows that from January to June 2020, 6,126 patients, and then from July to December 2019, 5,212 patients received mental health services from government health centers and other health facilities in Jinja District. This shows that there is a big number of Jinja District population experiencing mental health issues, thus hampering productivity and growth of the district. Mental health is a fundamental aspect of health. Mental health problems can be a result of concurrent or past sexual and reproductive ill events and vice versa. Article 25 of the Convention on the Rights of Persons with Disabilities states that persons with disabilities should have the same range, quality, and standard of free or affordable health care, including in the area of sexual and reproductive health. Yet, in 2017, the baseline survey done by Triumph in Jinja showed that very few adolescent girls and young women had access to sexual reproductive services due to many barriers, especially the attitudinal barriers from service providers. Governments have specific obligations under international law to respect, protect, and fulfill sexual and reproductive health and rights for women and girls with disabilities. Realizing the sexual reproductive health rights for adolescents and adolescent girls and young women with psychosocial disabilities, and these are the recommendations. We, the adolescent and young women with psychosocial disabilities in Uganda, make the following demands to uplift our well-being. Triumph self-advocates urgently call upon the government of Uganda, including the policymakers, implementers, especially health workers, to adhere to the goal of inclusion brought about by the Convention on the Rights of Persons with Disabilities, to which Uganda is a party to guarantee the right of access to sexual and reproductive health rights by adolescents and young girls with psychosocial disabilities. Tribe self-advocates urge sexual reproductive health service providers in all health service centers, including the FLEP, Marriage Stops International, to give us opportunities to make decisions by ourselves about our sexual reproductive issues, with support to ensure that our informed consent when needed. Information, goods and services must be in accessible formats to persons with disabilities, sensitive to their needs, and provided on the basis of non-discrimination with reasonable accommodations as needed. We urge the district health officer to take sexual reproductive health services closer to our communities through targeted community outreaches for girls and women with psychosocial disabilities. Healthcare workers must be trained to work with adolescent girls and young women with psychosocial disabilities to provide services that are based on dignity and that respect the autonomy of persons with disabilities. Triumph self-advocates urge police, mental health service providers, community development officers, and other stakeholders to use the supported decision-making models which prioritize the individual's will and preferences and protect her fundamental human rights, including rights related to personal autonomy, legal capacity, and equal recognition before the law. We demand that the government of Uganda fulfills the political commitment it accepted to implementing the Agenda 2030 of the Sustainable Development Goals by not leaving us behind during the provision of sexual and reproductive health services. In conclusion, I hope that we all strive to cause change in our societies. We all know that change starts with you and I. If we do not start this change, then who will? Because now we know this information, and since we are knowledgeable right now, we can go and start to see, to improve our societies and sensitize them. That said, there is no health without mental health. Thank you very much. Yes, my colleagues, but the one person I will forever ask God to bless her in ways I cannot is my mother. And I'm so proud to say that she's here with us. Kindly please stand. I'm so grateful that she has been with me through thick and thin. And I'm so proud to call her my mom. And then she's the one that connected me to Mama Triumph, who has also been very instrumental in my life. I don't know, like I say, the person is standing here is not able to stand here alone. I have strong people behind me, and I'm forever grateful.
The song, because they are getting off the stage to go to their places where
kantu wali mukisa guno ogamba nti mumaze okundaba nti ze mama wa Esther wadde asomye policy kuva mu nga adolescent kuva mu S3 twafuna challenge bwe twafuna challenge eyo tetwamulekerera n'omwami wange together twali naye paka olunaku olwaleero nga tumusupportinga kyeva olaba watuuse oli agambye waliwo omuntu okundaba nga ndi wano oba oluusi yandibadde nga abeerawo so kati ku lunaku nga luno twagala okwebaza twaya era ndoza bagambye nti kyenakola namuconnectinga ne Aunt Robina mama Robina kati ate nga Robina yagambye twali tukola wamu ne Robina mumanyi nga mala ne wiki namba ali mu depression but I think that time nali simanyi nsobola ntyo okumuyamba so kati ng'omuzadde nange neewaayo ngamba tujja kukolera wamu n'abazadde tuve mu negative attitude kubanga omwana oba omuzadde tusobola kwegaana mwana kati oba omuzadde bwotyo naffe twekomitinga nti tujja kubaayo tujja kwewaayo tulabe nti sensitization zikolebwa mu bazadde babe nti basobola okusupportinga abaana bano kubanga bano abaana bali fearful and wonderful made ate nabo balina ekyomugaso kye basobola okukola ba mugaso so kyebangamba nti tujja kwewaayo tube nti tubasupportinga mpozi ekirala ngendako ku UCU na lecturer at UCU ng'omusomesa nakyo njagala okutwala omukisa guno kubanga nina bendabye nga bali challenged nina galo gwen counseling ali depressed naye nga tali ku university ate abazadde tabakitegeerako yadde agezaako kubagamba naye abazadde balabika tebamutegeera omwana ng'oyo asobola n'okwetta kubanga kati gwe ng'omuzadde tomutegedde naye ye alina challenges zaayitamu so abazadde twetaaga sensitization neewaayo ng'omuzadde already mama wa muwala ali challenged naye nga she's coming out of it, she has really come out of it nti tujja kubaayo tulabe nti twesensitizinga tulabe nti tusupportinga abaana baffe babeera b'omugaso